right, so good morning, everybody. My name is Ali Hirji, the lead on the advisory committee for siberXchange. I am also the lead for the AI Hub and the Center for Cybersecurity at Durham College. Welcome to what is about to be a fascinating keynote in the Healthcare X section delivered by our friends at AWS. I'm going to turn it over to the amazing Mayor Shaun Collier from the town of Ajax to make some opening remarks and introduce our speakers. Mayor Collier, over to you.
Good morning, Ali. Well, thank you and welcome everybody. I understand we have hundreds, if not thousands of people online for the siberX conference. I'm extremely proud to be part of this exciting event, and thank you very much for having me and allowing me to welcome Amazon Web Services. So why me, you might ask? Well, I often say I'm the least technical person on a panel, but as a leader of a progressive and pro-technology council, I'm also the first to say that technology and technology training is the key to our future. In Ajax, we're embracing and championing technology collaborations that include the siberX team. Ali Hirji and the AI Hub, and several innovative and forward-thinking companies from Ajax and beyond. These partnerships have put the spotlight on how municipalities can embrace new technology, engage with the business community, and truly drive new innovation for all sectors of the economy. Last year, I was excited to welcome the Durham College Tech Talk series to Ajax. One session in particular was focused on technology and healthcare and how combining new ideas with AI, machine learning, and robotics could easily change the lives of so many. The keynote speaker was a young lady, only 15 years old, that was combining entrepreneurial ideas with new technology to solve healthcare challenges. Her energy, excitement, and tech background was extremely energizing, and this event helped put a spotlight on Ajax and our focus on new technology and training. Following that event, the momentum continued in August when my fellow Ajax councilors, Regional Councillor Crawford and Councillor Bauer, and I first met with the representatives from AWS at Cisco Canada in Niagara Falls. I'd like to thank AWS for connecting with our team because building relationships and support of business is key, especially in current times. Economies across the globe will rely on these kinds of relationships and partnerships as we look to post-COVID-19 recovery. Since our initial meeting, the town's AI and Ajax series, delivered to the AI Hub, has also engaged our businesses on various infrastructure offerings available from AWS to enhance their online delivery. Also importantly, Durham College's Center for Cybersecurity Innovation is studying AWS infrastructure to enhance security deployments. This is very important as more businesses move online and what's being termed as our new normal. On a side note, this very topic will be discussed further during today's panel at 2:15 with Ontario's Minister of Finance, MPP Rod Phillips, and MPP Khalid Rashid of Mississauga. I would like to personally invite AWS to join us in this important conversation as well. One area of innovation that we as a municipality would like to study more closely is the soon-to-be reality of connected or smart cities, where every experience for people can be seamless through the use of technology. From autonomous cars to smart streetlights to enabling healthcare to do it as intended, care for our health, municipalities can take a leading role in bringing new technology to the forefront. This is the exact reason why I'm very proud to be able to introduce our keynote speaker today, Dr. Shez Partovi. Dr. Partovi is the worldwide lead for healthcare, life sciences, genomics, medical devices, agricultural technology at Amazon Web Services, and has dedicated his life's work to the health of people and integrating technology to improve how healthcare is delivered. As part of AWS, Dr. Partovi's focus is helping the healthcare sector to use technology to create a smoother experience for patients and physicians, and further helping us as municipalities embrace and support technology in healthcare, as well as in our service delivery to our residents and businesses. Thank you to siberX for allowing me to share an Ajax message. I know I speak for all my colleagues across the province tuning in today when welcoming Dr. Partovi. It's an honor and pleasure to have you with us today, and we look forward to your insight and leadership in the world of municipal and health technology. Welcome, Doctor. Thank you very much.
Thank you, Mayor Collier. Thank you so much. And Team siberXchange, really appreciate the opportunity here to present. And to the audience, good morning, good afternoon, good evening, depending on where you are. I'm sure the global team here is on. What I want to do is first introduce you may have heard about Amazon Amazon Web Services is the technology arm of Amazon. And what you may not know that inside Amazon Web Services, we actually have a dedicated healthcare life science and genomics practice. This is composed of folks that have been in the industry for years. We want to bring together folks that have been at the bedside, been at the bench, physicians, nurses, researchers, pharmacologists. And so that practice does all the work around healthcare, life science, and genomics, as well as med device and agriculture technologies. And one of the real delights is that the fact that we get to work with a large ecosystem of customers and partners like yourselves. And what we really realize here at the healthcare life science practice is that every single organization that we work with, if you look at their mission or vision, they have one word that they share. Almost invariably, they make a reference to a patient. And that's really important to us in the AWS healthcare life science practice, because we realize that the work we're doing with these organizations and with yourself is ultimately intended to benefit people, to benefit humans. And so this concept that we are working through our customers to help elevate the human condition is really important to us as a practice. And so just wanted to give a little bit of background, introduce the practice to you. Today, I'm going to talk about sort of 3 themes. And these 3 themes will touch on sort of the COVID initiatives that we're doing, but also broaden the lens and talk holistically. We'll travel from Canada to the United States in terms of some of the examples. And so that's sort of the concept here. Let's talk about predicting health events, talk about the consumer health journey, and precision health, precision therapeutics. So that's sort of the intent. Now, talk about predicting health events. That's one of the things that a lot of health systems, a lot of organizations, a lot of public agencies ask us, can you help us predict health events? And you may say, well, how does Amazon, even AWS, even qualify in being part of the story? What's your credentials in helping actually predict health events? Well, you may be familiar with the fact that we do some things, for example, one-day delivery. If you wonder how we do one-day delivery, it's because we predict who's going to order what and actually move the products to the closest fulfillment center before they order it. This concept of predicting has been something that Amazon's been doing for 20 years. And what we've done now is apply that to healthcare, that same technology of doing prediction. So there's a long heritage of using machine learning to build prediction models at Amazon. And now we're bringing that to bear on healthcare. And the first example, and for example, if you wonder how you get your recommendation for the next movie, it's Netflix is using the Amazon technology underneath. At a time when we used to travel, if you imagine how Expedia would recommend your next trip, it's using the Amazon sort of machine learning prediction engines. So these are all technologies have been used in other industries, and now we're helping bring that to healthcare. To give that example, let's travel across Canada, go to Vancouver, and talk about what a great team over there, Dr. Savas Nicolau of the Vancouver General Hospital, and what they're doing in predicting COVID. So what Vancouver General Hospital did is actually load up a number of CAT scans into the AWS cloud. And they did that because they could apply complex machine learning algorithms to the data once it's in a cloud. They could apply a massive amount of compute so that they could build these prediction models very quickly. And in fact, they collaborated with other teams from across the globe, from South Korea, from China, from Singapore. Data from CAT scans from across the world were brought together, and experts at VGH were using that to train a machine learning model. Now, there's one interesting thing there is that in order to ensure that there was no personally identifiable information, because if all these CAT scans come together, you might imagine and say, well, gosh, you're bringing all this data together, so what about privacy? What about sort of the securities and so on? And one of the services at AWS called Comprehend Medical actually is able to identify personally identifiable information and actually extract it from CAT scan images on the fly, or from medical reports on the fly. So the Vancouver General Hospital team, VGH Dr. Nicolau, used those technologies to actually extract the patient identifiers and load all that data into the cloud. And once they loaded it there, to apply machine learning to build the model that looks at the CAT scan of the chest of patients and predicts the likelihood that they're going to have COVID, and as a tool set for doing this. They've trained the model on, I think at this point there are several thousand CAT scans from across the world, and built this model. And so this is an example of using machine learning to predict health events. One other example I want to give you is let's expand the scale quite a bit, because this is terrific, and thousands of data points is laudable. let's go ahead and look at, for example, Cerner. Cerner is the largest health information technology company in the world. Their entire longitudinal patient record is on AWS. And so when they moved everything to the cloud to apply the same sort of machine learning and AI, ML technology, they moved about 200 million records into the cloud. And of those 200 million records, we de-identified about 210,000 of those records and looked for congestive heart failure and applied machine learning to the cases that had congestive heart failure, trained the machine, and it was able to predict congestive heart failure 15 months prior to it occurring. We trained it on 210,000 patients, then brought 3,000 patients it had never met before, the machine learning model had never met before, and it was able to predict with 91.5% accuracy the chance the patient would have congestive heart failure in 15 months. That means in real life, a clinician, a physician comes up to the electronic health record, fires it up in the emergency department, and the record opens up, looks at the past 12 months of data of this patient on the fly, and tells the clinician, the nurse, the physician, the probability that this patient is going to develop congestive heart failure in the next 15 months. As a clinician, what would you do different if the model said, you know, red, yellow, green, that there's a high likelihood that this patient is going to have congestive heart failure? This is just an example. The point being is that predicting health events is dependent on large amounts of data, applying machine learning with high compute power, all the things that AWS is good at. And those prediction models are now being embedded back into workflow. So clinicians are able to take advantage of those machine learning powers in the cloud and then make better clinical decisions. It's another tool in their tool belt. It's not making a diagnosis, but rather providing that insight to the clinician to make that diagnosis. So that was an example of predicting health events. We talked about VGH and what they're doing with COVID, and then sort of scaled it out to Cerner and doing it at scale globally. What I'm going to do now is switch over and let's talk about the consumer health journey. When we talk about the consumer health journey, now some of you may have heard of a device called Alexa. Now, Alexa, actually, if you take the two A's away, you end up with Lex. Lex is actually an AWS service. That means that that conversational agent that's in that device that you have, that conversational agent is available as a software technology to embed in other solutions. In fact, AWS has a whole number of voice-related technologies because the consumer health journey today is being augmented with all kinds of voice technologies, the Alexa type conversation, whether it's SMS bidirectionally, natural language SMS, whether it's voice, whether it's chatbots on a web. And so now let's go ahead and apply some of this. Let's travel, we're in Vancouver, let's drop down to Seattle, where if you recall in the United States, one of the earliest outbreaks for COVID happened in the Pacific Northwest in Seattle. And in that story, what happened with UW Medicine was all the individuals in the community, which were understandably concerned that do they have COVID? Are they acquiring this infection? And so suddenly started calling UW Medicine and asking for help. Their call centers got overwhelmed. Their call wait times volumed completely out. And so what they were trying to figure out is how could they bring in technology to bear? And working with AWS, we built a conversational agent that plugged into their call center. And this conversational agent used their clinical algorithm and was able to answer 41% of all the inbound questions. And then the off-ramp was either, you're fine, here's some information. The off-ramp could have been, you deserve testing, or that they escalate them to telehealth. So you can see about 41% were managed by the chatbot, about 20% were sent to testing, and about 30% were related to telemedicine. Now, that was one example of a lot of worried well calling in and overwhelming a system. Now, you see all those yellow persons that are sort of the worried well, but you see all the orange ones when I started with. Let's go cross country to New York, the next hotspot. And what happened there is the same overwhelming event occurred, but what happened is that the health system there, one of the organizations, Metro Plus, said, well, wait a minute, what happened to all the people that had chronic conditions, that were vulnerable, that had cancer, that are elderly? Their voice has been drowned out by the onslaught of worried well people. And so they reversed the technology, and working with AWS, we built a machine learning model that looked at their patient data and said, these are individuals that normally contact us, but they're not. Where do they go? And we built a conversational agent that actually reaches out to them with two-way SMS and says, how are you doing? Do you need any help? Based on questions, we're either elevated to hotline for COVID, to pharmacy, emotional support, for telehealth, or just basic support. And in that regard, about 10,000 SMS were sent out for the Metro Plus patients per day, about 9% engagement rate. Half of those actually wanted some help, and 65% were more social help, and 35% needed clinical help. And so that was an example of the reverse, using voice technology and AI to create, because you can't hire enough people to make these calls, at least not at scale. So that was the second example. Last example is, remember again, all those people that called in and were worried and may have had COVID. Well, some actually have COVID and are diagnosed and are in the community with COVID. Now, the thing with COVID is you can't keep everybody in the hospital. You want to send them home, but the condition is such that actually in the course of 24, 36 hours, you could really suddenly decline. So you have this tug of war between, I can't keep everybody in, but if I send them home, do they have the know-how to know when to come back? And often the conditions were that people were coming back too late. And so working with another health system, we built out this monitoring using, again, a conversational agent, voice automated, SMS automated, to actually reach out to the people that were sent home with COVID, ask them questions, and alert early detection, early intervention to bring them back in, because the health system was predicting that they're not going to be doing well, to bring them back. So all these were using asynchronous means of conversation, using voice conversational agents, bidirectional SMS, natural language SMS, you just speak, or chatbots on the web. Now, one example, let's go back to Canada. The other example here is, of course, I didn't even talk about the camera on those devices, because you could elevate all this to telehealth. And Ontario Telemedicine Network, now, of course, part of Ontario Health, built on AWS. And we have today with us Alex Redeboim, who is one of the lead architects and leading the innovative work at Ontario Telemedicine Network. And let's now talk about synchronous and video. And I'm going to pass the baton over to Alex, who's going to tell you about OTN and the terrific work they're doing there. One of the largest telemedicine networks. In fact, I think, Alex, it might be the largest in the world. So I'm going to let Alex take it from here, stop sharing, and let Alex jump on, and then I'll come back.
Great. Thank you very much. Pleasure to be here talking about the work we've been doing at OTN, and of course talking about information security, which is a passion of mine. I've been an information security professional for many years, as well as an architect and technology leader. And in healthcare, you know, I've worked in a lot of different spaces. I've been working most recently in the Ontario Telemedicine Network, but before that, I used to work in the medical device industry, where I was part of a product development team for dialysis and infusion therapy devices. And before that, I was even working for a health information system company. So in OTN, you know, we have a little mantra, you know, there's no time for downtime. And so this invariably led us to our journey to the cloud. And if you think about Canada, you know, we're famous for a lot of these things. We're very well known for our beaver tails, maple leaves, and hockey, but we, many people don't know this, but we've actually been doing quite well in the telehealth arena for many years, but we've just been typically Canadian about it. We've been very polite and we haven't been talking too much about it, but we have been actually doing telemedicine before all of the fancy apps came out and everybody was you know, talking about this commonly. So telemedicine itself is obviously the use of these innovative technologies, different kinds, to be able to bring a physician in remote contact with a patient, so using non-traditional means. And OTN is basically everywhere throughout Ontario. there isn't a health organization in Ontario that's likely not a member of OTN. And as mentioned, originally OTN was a not-for-profit that was funded by the government of Ontario, but now we're officially part of the Ontario Health Government Agency. And if you look at our services, yeah, we are going to spend a lot of time talking about video right now, but we have other services too. We provide a health provider directory, which allows healthcare providers to find each other. One of the big challenges with telehealth and telemedicine is finding a healthcare provider that is offering the kind of services that you need remotely. And so this directory goes a long way to do that. You also have eConsult, which allows physicians to ask other physicians for advice. And this is, the idea is to avoid in-person referrals. And this service has been growing quite a lot and has been actually quite helpful, especially during these times. We have a remote patient monitoring solution where patients that have under different modalities are able to be remotely monitored by a nurse, and you know, intervention is provided where needed. But this also helps avoid readmittance and other factors. And of course, some of our newer services are enhanced access to primary care, which is essentially a virtual waiting room. But let's talk a little bit about where it all began, right? And it all began with video. And this has been going on in Canada for many, many years. And it's been used by physicians and healthcare providers and organizations and families and patients. And the way it all started is, the way it all started is between actually different facilities. So in the past, what would happen is, you know, people, if they needed to see a doctor, they would have to travel, and sit and wait. And what was happening is that some people were not getting the access they needed simply because healthcare facilities were not that close to them and they had to travel very far. So this telemedicine network grew out of a solution where people could travel to a clinic that would be closer and go to a room with video, and they could actually see a physician far away in the center that then could advise them and look after them. And this is essentially how it began. We call this the room-based video conferencing. You know, it's still ongoing today. It actually has a few uses that have not been replaced by the newer types of telemedicine. Now, if you look at, generally speaking, what we've been experiencing with telemedicine is we've been experiencing quite a lot of growth. Even before the pandemic occurred, telemedicine was actually growing quite a lot. We had a very active number of cases, and it was growing year over year by 36%. And, you know, this led us to make some interesting architectural decisions. We saw that telemedicine was going to grow. It was growing more and more, and we had some issues like everybody else where we had legacy aging infrastructure, and we needed to make sure that we were able to keep up with the demand. And so we decided to go to the cloud. And, you know, why do people go to the cloud in general? Well, the reasons are elasticity, high availability, fault tolerance, little or no downtime. We wanted to have a self-healing network, so if things went wrong, we'd be able to quickly act and replace those resources. I mean, these are usually all the good reasons to go to the cloud. And, you know, we chose a cloud architecture that used some really good services from Amazon. Well, you know, EC2, whenever you start your journey to Amazon, that's what you start with. That's your essentially compute, right? But there are some very other interesting services that enabled us to do what we needed to do, like the Lambda, which I encourage everyone to look into. This is a really great thing. It leads you to serverless computing, which is really the future of computing. And it has many great applications. And, you know, if you're using AWS, this is kind of like a Swiss Army knife. It'll help you do anything in there. And of course, other things like CloudWatch and Route 53, which are also great tools and also helped us out. Now, if we look at everything I talked about, telemedicine's growth changes when you start thinking about COVID and the impact it had. Now, I know this chart, you know, it's kind of looks like we didn't have a lot of activity, but the scale is a little off. We did actually have quite a lot of activity. We were actually quite busy before that, but look what happens when COVID hits, right? So our usage increased exponentially, right? And incidentally, that arrow over here not just defines, you know, when the COVID pandemic started, it was also the last time I was able to get a haircut. So thankfully, Zoom has added virtual hair in addition to virtual backgrounds. So I was able to clean it up a bit. But our usage spiked exponentially. On the other hand, though, despite the fact that this happened, we actually woke up one morning and we didn't really have significant problems. I mean, we had some, but we had more resources from Amazon that met the demand, and that's actually the beauty of the cloud, being able to scale to meet demand automatically, right? So with that, though, that was the good thing. People needed telemedicine because of the pandemic, and they weren't able to access resources in person anymore. And but the bad thing is that in addition to attracting a lot of people who really needed healthcare, we also attracted more security threats, right? So the media has focused and done a great job on raising our awareness about all of these social engineering attacks that are happening. We've seen a lot of those as a result, targeting home workers. But in addition to that, what we saw is also large spikes in just general attacks, brute force attacks, SQL injection attempts, all kinds of probes. And while we have taken some of our infrastructure to the cloud, we do have quite a bit of stuff on premise as well. And all of this caused a lot of high resource utilizations and firewall rules, and et cetera, right? And so, when you look at the security threats that we were seeing here, you can see around March, there was a pretty big spike, and then they started to go down. And why they started to go down was that we started to look into how to mitigate these attacks and actually offload a lot of our activities that were hitting our firewalls and our infrastructure off to somebody else, like Amazon, right? We decided to let Amazon deal with that problem. And in fact, what we tried to do is we tried to start making use of all the threat intelligence driven safeguards that Amazon provides to its customers, and to make intelligent decisions about how to block that traffic that we didn't want. And we didn't just do this for our environment in Amazon, we also actually started using it to protect our on-premise infrastructure as well, right? The beauties of the hybrid cloud. So, I mean, things like threat intelligence and behavioral analytics are a key thing these days in the security toolbox. I mean, we can't live without it. And by threat intelligence, I mean, let other people try and figure out what are, the right rules to have, and what are the bad places, all the bad traffic in the world, right? You just can't do that on your own. So you need somebody to do it for you. And luckily, you have a wealth of tools to work with. And we work with all of these tools, and we're adding more and more. For example, guard duty is a great thing. I always recommend that anybody that has an Amazon account that enables it right away, gives you a lot of threat intelligence, starts telling you exactly when there's some suspicious activity. And you can actually, using Lambda, my favorite thing, right? You can actually create a playbook. And that's what we did. We were adding triggers. Every time guard duty had something suspicious, we would actually trigger a Lambda function. We would do something about it, change the rules in our network, do some other things. We use the web application firewall and the new managed rules to actually embed threat intelligence and monitor our traffic for on-premise websites, right? So those websites were being hit a lot. CPUs were spiking in all those servers. So we put the WAF in front of it, and that had an immediate effect. You saw in my earlier diagram. And so there are a lot of tools. There's new stuff coming out. There's Amazon Detective. We're looking into that quite heavily. Like, this will automate our threat hunting and actually make investigation a lot easier. And I think there's a constant innovation happening, and we have to be, as security professionals, very diligent in looking at these things and trying to make sure that we are constantly vigilant and are using the innovations that are coming out of the cloud. And anyways, thank you for giving me the opportunity to speak about OTN. And if you have any questions, don't hesitate to reach out and ask.
Alex, thank you very much for that. We have about 2 to 3 minutes to take questions. We'll take a question from Dr. Khalaf, and Dr. Partovi or Alex, I'll leave it to you to decide who wants to respond to this. The question was, what type of data was collected or can be collected over 12 months to predict congested heart failure? Dr. Partovi or Alex, anybody wants to take that?
Sure, I'll go ahead and answer that. The actual data is already in the electronic health record. So that there's actually not what happens in that model is it simply looks at the electronic health record and whatever data has been in the environment. So we're not specifically adding any overhead of workflow to collect specific data. The chart, whatever data is in there, it's trained based on those. Now, of course, some elements affect the model more than others, but it wasn't a specific data collection exercise. So if you have 2 minutes, let me finish this last piece because it's such a terrific story.
Absolutely.
And I promised everyone I'm going to tell them 3 things. The precision therapeutics one is left, but it's very short. So we talked about predicting health events. We started in Vancouver, we dropped to Seattle, went across to New York, went to Ontario. I want to take you back to Vancouver and talk about AbCellera. AbCellera is a company that is focusing on building therapeutics that are precise. And AbCellera, actually, what they do is incredible. So they will take 5.5 million B cells from a single individual. They look at finding therapeutics as a search problem, as a computation problem. They use machine vision on AWS to look for the right sort of antibodies using fluorescence in an actual cell, and then identify that particular cell line that will create those antibodies. And in this case, they're working on therapies for COVID. The thing is that that's a computational problem. They look at, it's a massive data problem, 5.5 million cells, taking the data from those cells, then applying a search algorithm using machine vision, looking for a particular antibody to bind to a particular antigen for a particular cell to prevent the infection from COVID. That's all possible simply because the massive compute that's available in the cloud, this kind of precision therapeutics simply would not be possible these days. So that was the last thing I'm going to tell you about. I know there was a question about education. It was apropos because there actually is, in collaboration with Digital Health Canada, there's a Digital Health program. It's about 12 hours of, so I'm answering the question at the same time here. And 12 hours, of course, mercifully it's online. It's over the course of 4 days between June 22nd and 25th. So by all means, come by the virtual booth, AWS virtual booth in siberXchange here. They'll tell you more about it. And that will answer the question of, are there training sessions for this sort of thing? So with that, I'll wrap up. I really appreciate the time. Thank you so much. And I know we went a few minutes over, but hopefully that gave you a whirlwind view of what both AWS is doing broadly and particularly in telehealth in supporting Ontario Telemedicine Network. Thanks so much for the invitation. And thanks again, Mayor Collier, for the introduction and the invitation.
Thank you very much, Dr. Partovi. On behalf of the advisory committee, of which I am the lead, as well as my students and colleagues at Durham College, and all of my friends at the region of Durham and the various municipalities that have joined us from York. I see folks from the region of York. I see folks from Peel region. I see folks from up north as well. I want to thank all of them for attending. And for those of you who have more questions, please feel free to go into the networking zone and interact further. With that, I wish you an enjoyable conference, and I'll see you in other sessions. Take care.
Thank you.
Thank you.